Welcome. I'm Dr. Vinay Prasad. I'm a hematologist-oncologist, and I'm Associate Professor of Medicine at the University of California, San Francisco. In my professional life, I see patients, I teach trainees, and I do research in healthcare policy. This is Plenary Session. Plenary Session is a podcast at the intersection of medicine, oncology, and health policy, and you're listening to Season 3. On this week's episode.
This week, I'm joined by Steph Baral and Julia Marcus, and we're going to talk about COVID-19 and messaging. You won't want to miss this episode.
If you like this podcast and want more content, follow me on Twitter at vprasadmdmph. Check out the YouTube channel, Vinay Prasad, MD-MPH. Patreon backers will get access to the slides for lectures I give on Plenary Session. Want to hear from us? Email us your question at plenarysessionpodcast@gmail.com.
All right, I'm back in Plenary Session. I'm joined via Zoom by two people who are friends of the show. Julia Marcus from Harvard University and Steph Baral from Johns Hopkins University. It's a pleasure to have you both back.
Thanks for having us.
Yeah, it's a pleasure to be here.
So, one of the things that I was telling Julia privately recently was that COVID is a litany of bad things. There's no one's gonna say otherwise. It's affected us all in deep ways, psychologically, socially, economically, and it's affected vulnerable people, I think, even more than those of us who are lucky enough to have a job where we're able to do most of it. So many, many bad things. The one good thing is it brought a few people together. I think it allowed me to see some voices that I hadn't seen before, and I'm really grateful for that. And I put you both firmly in that category of people who I think I knew a little bit about your work, but I didn't know as much about it as I wish I had, and I'm grateful to have learned about your work. So I was wondering if, I don't know, maybe I'll start by tossing this out. You both find yourself in an interesting position because you have sort of experience in thinking about public health, thinking about messaging, and we now have a new media that we've never had before. And we are now months into this pandemic, and you see examples of messaging all across the spectrum. So I wonder if you might just take a minute to tell me, like, I don't know, what do you see that catches your eye? What do you see that you like? What do you see that troubles you? Maybe I'll start with Julia, and then we'll go to Steph, and then we'll just go from there.
So just to clarify, are you talking about social media?
Yes, let's talk about social media. Yeah.
Yeah, so I mean, I don't know if I'm the best person to answer this question because I joined social media shortly before the pandemic started. So I don't have like a
pre-pandemic.
Exactly.
Yeah.
I don't have pre-pandemic follow-up time. But I have seen, first I'll start with the positive. I feel like there's been an amazing use of social media during the pandemic for science communication, not just to the public from scientists, but also between scientists. It's an amazing place to learn. And I think that's what keeps drawing me back is partly that opportunity to not just, see a new paper that came out, but hear what like the top expert thinks about it in real time. I mean, that's incredible. And it's something that's what draws
you in.
It is one thing that draws me in. Yeah. And I think it's a huge asset. And then in terms of communication between health professionals and the public, that has really captured my attention. And I think was one of the things that made me want to start writing about the pandemic was watching this dynamic that you don't normally see, because normally like a health department or the CDC will put out some guidance.
Yes,
and you don't see the public respond to that in real time.
And there's no back forth. There's just guidance and then you interpret. Yeah.
Right. And there are ways that the public does digest and respond to that guidance. You just don't get to have your finger on the pulse of it in the same way that social media allows. And of course, social media is a selected group, and you yourself are seeing a tiny selected group of that selected group. But still, it's some way to like take the temperature. And I think there's been a whole range of ways that has been used. And I think also typically like the typical epidemiologist or virologist or immunologist doesn't have training in how to communicate with the public and has been learning on the fly. And I think many people have incorporated that knowledge over time during the pandemic, and maybe some more than others.
That's very interesting. And I'm going to want to explore that theme in a minute. What about you, Steph? What are the things that come to your mind that you see, you like, you don't like?
Yeah, I mean, I think there's a number of positives, and I think Julie described them well. I think what I joined Twitter. I remember I first joined Twitter when, Demi Moore sent a tweet in 2009. And, and I remember there was a guy who was stuck in jail in Cairo. And then he tweeted help. And I remember hearing about this new platform, and I joined it because I joined all platforms, not to use them, but just to almost hold my name, because I have a particular username that I've used for everything for my life. But I didn't use it. And I think I sent a tweet a year, maybe, or not, for the last decade. And I think what struck me in early March was it became a go-to platform. I've been part of multiple public health responses, both at a municipal level, kind of global research. And I never sort of felt I thought a lot of the communication was happening in the context of organized meetings that were either consultations hosted by WHO or by CDC, press releases. It felt much more organized in terms of the sort of filters that existed. And then media, the traditional media, would pick up, their experts from the pre-filtering that happened, in terms of who was in the consultation, and then, or who a university would put forward, their comms teams would put forward as an expert in something. So there was a lot of filtering that happened. So the final messaging that finally came through the traditional media felt a little bit more streamlined. Right.
Okay.
And I think, what I started seeing in early March was, the folks on Twitter were advocating, but they were often advocating in terms of their own spheres. And it felt very quickly that people who are not on Twitter, in terms of the general masses, we know that Twitter trends rich. We know that Twitter trends more educated. And it felt very quickly that there wasn't really a lot of folks talking about hey, I just lost my job. I literally I had a job. I was providing for my family, and now I have lost my job, and that's painful. And, we know employment is a social determinant of health, and we know it's important, and Julia knows this well, and I think you do. I feel like I'm borderline a socialist. I believe in universal healthcare and universal education. I wish government organized car insurance. Do you know what I mean? I believe in universal everything.
Yeah.
But that doesn't mean that I don't appreciate that the economy is linked to people's well-being. And I felt like there was, it's been one of the many false dichotomies of let's not worry about the economy. Sure. Let's not, other than the fact that it's related to people's well-being. And I think that struck me early in March. I just felt like we're not hearing from the people on the wrong side of the very many things that are happening right now. And, it's continued to strike me. And I think even as this, both of I'm a person of privilege, like a white, cis man, who can work remotely. And so it's I've been blessed with all these privileges, and I continue to be privileged during the context of this response. But I feel that we have to be wary of that, to not reinforce our own privileges, or not only act in the context of our own privileges, or the world will never get better.
Oh, that's so well said. Oh my God, you gave me 10 things I want to ask you both about. But I guess, just to summarize, I guess I would just say, it sounds to me like one of the things that has happened here is that, I've been on for, as an avid user for 5 years and maybe 6 years, so 1 year of lurking. I spent my year, just looking in and seeing what people are saying. And I've noticed that it's really shifted dramatically in the pandemic, and I guess naturally so, from a place where initially you would talk with friends and you would use a certain sort of colloquial language and certain kinds of jokes, to talking with more colleagues in your field, to talking with maybe the whole department, to talking with a few people in the public, a reporter here or there, now to really talking with society. And that's a very different way to talk. And I don't know how I feel about it, because sometimes I want to still have a place where I can say, hey, I'm thinking about this. I'm thinking this way. I'm thinking that way. What do you all think? Thinking I'll hear from Steph and Julia, and thinking I'll hear from my oncology friends sometimes when I talk about cancer. I want that space. But then I can't forget that sometimes it's somebody from Idaho who's I don't know, about to vote in something, and they, and they want to know what do I think about it? I'm like, oh, I don't know. So it really has these many, many audiences we can talk a little bit about. And then I think, Steph, what you're really hitting on is something that I've just been stuck with recently, emotional valence. Some things have more emotional hold on us. I was just recently ranting about the New York Times. I mean, not rant, a little critically. The New York Times has that counter, and it says 394,442 dead. And you see that, and you're like, God, that's awful. There's a lot of, that's people's loved ones, their grandmothers, their brothers, their sisters. And so it's easy to say, like, whatever we do to bring that damn number down or slow that number, we got to do everything. But then all the sort of unanticipated spillover effects, like, okay, let's close the schools. Well, how many kids are going to get physically abused and no one will find it? How many kids are going to go hungry for the day? I'm hearing more and more stories about, a lot of parents are just leaving, people who have to work, they're just leaving their kids at home unattended. We're not talking about old kids. We're talking about 5-year-old kids, 6-year-old kids. There's always a few stories that come up. I don't want to hang on too much anecdotes, but, somebody finds a gun and shoots their sibling or something, somebody sent me a story like that. Those are not there's not on the New York Times counter for that. And so it doesn't have that emotional valence. And many of us, who are in academia, we are, we can live in the Zoom world. I mean, I can do most of my academic work in the Zoom world. The only thing I can't is clinic, but I can go there on Wednesday and I can wear my mask and that sort of stuff. So I don't know. I mean, I think that those are some of the core challenges, I guess, in this social media. Who are you talking with? And what are the things that pull on your heartstrings? And are things pulling equally? Julia, any thoughts on those two ideas?
Yeah, I mean, I was thinking about this also when Steph was talking too about the ways that, if you have kind of standard public health communication during a pandemic, it's being filtered through teams of people at a health department or the CDC, and the product in the end is something that's ready to be public facing.
Yes.
So when you have social media, you have a bunch of individuals who are filtering through their own lens, and that may be a lens of privilege. It may also be a lens of fear, maybe a lens of anger. It may be a lens of deep sadness right now. I mean, there's so many ways that our emotions are high, and we cannot. We don't have a team of, I don't have like a team of people here in my bedroom that's like filtering my messages before they get on Twitter. And so, and you can see that I think often in what people are posting when they're doing science communication, you can feel the emotion there. And often that emotion, I think, is anger. And that's, I think we all have reasons to be angry right now, but I think unfortunately often that turns into anger at the community that you were trying to help.
Anger, fear, shame, outrage. I mean, I think that kind of package emotion. Yeah.
And of course, we know social media rewards those.
That's what I come to. I don't know. I said something I shouldn't, but I took two tweets. I don't want to name the people, but they're both tweets about vaccination, what it means. And one person said something I thought actually quite beautiful, a really beautiful metaphor about once people are vaccinated, they can be very close together. And one person said, once you're vaccinated, you still should wear your mask and okay, wear your mask, And I thought to myself, I just looked at the scoreboard. I mean, the scoreboard is 5 times as many people liking and retweeting it. And that's not the lovely message. It's the fear-based message. But that's just the kind of animal we are. And that concerns me. Steph, you were going to say something?
Yeah. I mean, I think, so I mean, I'll just say, I think it's really natural. I think that in times of I'm obviously not a soldier, by any means. But I imagine that a big part of the training, in times of crises is about really ensuring that no matter how large the crisis is, right, that you have an approach, like a structured approach. Do you know what I mean? The closest I've ever come is managing codes, managing a code blue, right? Mm-hmm. It's the worst situation to be in. I mean, I'm sure some people get a rush out of it. It's for me, it's every part of it is horrific. But at the same time, there's an approach that you go through to trying to manage your fear and your anger so that it doesn't drive your actions, but at the same time, being aware of those emotions and recognizing those emotions. And I think, what within Twitter, there's not kind of a structured outcome like that. So it is natural for people to take, we were reflecting on this today with the brightest scientists that I know, like Julia and Muge Sevic and others, and saying that it's been very difficult. And people have been attacked, for whatever it's worth. I've been attacked, called whatever. And it's, you know, I think that like, if you have the wherewithal to try to absorb as much negative energy as you can, then you should try and do that. Just take people's negative energy as much as you can absorb, and then try to put it out and try to engage constructively. Because I think when you reflect anger back with anger, you know, people just reinforce their positions and, you know, you don't resolve anything. And so I think that like I think this is a fundamental problem with Twitter, the platform and it needs to address this, because I was thinking like in the end, it'll just be like the Thunderdome. Do you know what I mean?
Yeah.
Like from Mad Max.
I feel like it's getting there. It's getting there. Yeah.
No, I mean, that you're filtering out these wonderful folks. I mean, I'm going to name somebody. Monica Gandhi has been, you know, a leader in infectious diseases for a long time. And I'm, as having come up under her leadership, I've seen her lead for a long time. I've seen her be warm. I know she's front line for a number of different, pandemics. And so it's not that it's about her. It's just that I know her outside of Twitter, and that everything she shows on Twitter, from what I know of her, is also what she is as a human being. So, you know, I think in that, you know, I think some people are better able to like filter their persona and their Twitter, you know, kind of like dynamic, and some people are not. And I think almost the better you are at Twitter, I don't know if there's like a skill set at Twitter, but the better you are at Twitter, I think you do create a little bit of separation between those two. And I think there are certain folks that are just going on there and are sharing their feelings, and they're not rewarded for it. You know, and you know, and I think that the lack of sort of like, you know, whether it be sympathy or empathy, depending on your own experience with seeing people share their emotions, is driven by fear and anger. And I don't begrudge anybody. I also like, I say this, somebody asked me recently, well, why don't you believe in COVID zero? It's like, it's not that I don't believe in COVID zero. I don't want anybody to die of COVID. Do you know what I mean? I've taken care of folks with COVID. I've managed outbreaks. I've done all of that sort of frontline stuff for now almost a year. You know what I mean? And of course I want COVID zero. The question is not about what the goal is. It's about what we're doing to get there in a very practical way. So I'll say that I think Twitter, the platform, does have things it needs to figure out in terms of like how it rewards emotions and how things show up in feeds and who it recommends. And, you know, because I know they're doing ongoing sentiment analyses. Like I know that they're analyzing these things in real time. So they know. I think there's just a matter of like how the goal of Twitter as an information sharing platform probably intersects with the goal of Twitter as a business. And driving advertising and those sort of complex dynamics that exist therein. And that is just something they have to grapple with.
There's another thing going on here too at the same time, which is that we're all lacking in-person interaction. And what does that do to our use of social media? And, you know, for me, it creates more of a pull towards social media that I didn't have before, simply just because I'm not around people. So it's like a way to
talk to people,
to interact, to find a sense of community. And as you said, like you've discovered these people during the pandemic that you hadn't known before. And that for me has been the best thing that's happened in the last year, is finding colleagues who think the same way I do, who have literally kept me sane and functional during this time. But how does that, what does that do to our online interactions, that we are lacking this sort of broader context and outlet that we should have, that like relieves pressure, you know? It all ends up online.
You know, I think that's like, I sometimes like imagine a conversation that I see on Twitter and how it happened in real life. And of course, all the escalation becomes de-escalation. So like in real life, you'd say like, you know, like after you're like 14 days out after your second dose of vaccine, like you can definitely relax something. You can go meet your grandma. You can take your mask off here or there. And then in real life, somebody say, whoa, you know, come on. I'm still a little bit nervous. I want to get a little bit further, more data before I feel comfortable doing that. You're like, yeah, okay. That's reasonable too. You know, I'm just a little bit more, you know, adventurous, and I feel feel like I really need to hug my grandma. And then you're like, and then you have a little chuckle about it. And then you go on with, you meet somewhere in the middle. But in social media, it's like, oh, you start with I know, because I've put myself there. After you get the vaccine, second dose, you're asymptomatic 14 days later. You can take things a little bit easier. You can relax a little bit. And they're like, look at you, you son of a bitch. They're like, you're empowering the anti-COVID people that don't even believe in COVID. And then they hear you, then they're going to believe in it more. And they're quote tweeting you. And then you're a bad person for having this and blah, blah, blah. And it's just like up a volume up. And then, I'm not as good as Steph. Maybe now that you've told me that, I will learn, because I think there's a lot of truth to what you said. But I mean, my instinct is just to be like, if they're going to be a dick to me, I'm going to be a dick back. And then I'm like, why don't you, learn to read this thing before you talk? But that's not helpful. But that's the difference. It's just the volume up. And my colleague put it well. He said, in real life, I like most people I meet, but on Twitter, I hate most people I meet. And he says, there's something about what's going on that's driving that. But I want to talk for a second about, maybe a different topic. We can talk about social media all the time. I guess I want to talk for a minute about, for me, what does the end of COVID mean? And I guess I'll put my cards on the table. I don't believe we'll ever have COVID zero. I think it's going to be an endemic virus that's always going to have some outbreaks, and there's always going to be, you're going to read about nursing home in Pennsylvania has an outbreak of SARS-CoV-2, and unfortunately, 33% of the people in the nursing home died or something like that, despite vaccination, despite all this stuff. I think it's going to come like that in bursts here and there. When we, eventually, I think, it won't end with a bang. It'll end with a whimper. And it'll end when, I'm reminded of that Malaysian airliner that was flying over the Indian Ocean. And then for 16 weeks, CNN literally every day was that Malaysian airliner.
Oh, I remember that.
You remember that? It's like, where did it go?
Of course.
They even speculated that a UFO, I swear to God, there was one where somebody speculated it was nabbed by a UFO. And I was like, okay, they are gone too much on this Malaysian airline. But I think COVID, we're in the Malaysian airliner phase of COVID. It's every minute of every breath of everything. And I think it'll end the moment where you go 4 days and you didn't hear about it. Then you hear about it again. But I guess I'm curious, and along the way of getting to that moment, we can talk, this is a whole nother thing to talk about, but talk about the inequalities that will be perpetuated. And I think, you've been talking nicely about that, what you've seen with vaccines. But I guess I'm wondering if you might, I don't know, what does that, for the people out there who need that optimism for what will it look like? What does the post-COVID look like? What would you tell them? Maybe Julia, you want to go first on this?
I'm going to let Steph go first.
Okay, go.
You know what? First, I just want to reflect on the Malaysian Airlines flight, because first of all, it's such a tragedy,
yes.
Right? But what's so interesting about that, during that tragedy, was that, MH17 happened, the other Malaysian Airlines flight that was shot down over Ukraine. I know this because there was the Australia AIDS conference, and there was a number of scientists and HIV specialists on their way on the Amsterdam Kuala Lumpur flight that were then going to connect on to Melbourne, and were sadly killed in that. And it was in the news for a day. And it just, I think that, and I was always struck because it was such a tragedy, and I was on my way to that meeting as well, and a lot of calls, and people are like, are you okay? And it's like, this is not about me, but I posted one of those, I am safe, because it turned out there was one Canadian on that flight, and they were like, are you the Canadian? I'm like, I'm not I wasn't that person. But it was interesting about what captures the attention, irrespective of Twitter, which is what captures the attention of people. And it's often about mystery and intrigue, and what I think Peter Sandman and Jody Leonard and others talk about as outrage factors. Do you know what I mean? And there's a number of things that were kind of intriguing about that Malaysian Airlines flight, because it was mysterious as compared to the tragedy that happened with the one that was shot down over Ukraine. And in the end, the same number, it's just people, a plane full of people died. But just in terms of how the public reacted to it, I think has always been instructive to me. So it's just because you raised it.
No, yeah, I think that's a very good point. Yeah.
I think that, when I think about this pandemic ending, I was, the definition of an epidemic is, more cases than expected, basically, right? It's observed versus expected. When we having managed outbreaks, for most of my career, outside of, I should say I've managed outbreaks in the early part of my career, then went into academia where I've been doing more research, and obviously now for the last year have been back to more hands-on management. I mean, an outbreak is even on site is like any cases more than you'd expect. So for COVID, that means like one case is a suspect outbreak, 2 cases with confirmed on site is a real outbreak. An epidemic at a city level, often it's very subjective. I mean, if it's 0, then expected is like any transmission
right.
is then you're in epidemic stage, and pandemic obviously is that across multiple countries. So, I think that like what's not going to change is like, I think you said it's not going to be that like it goes to 0. This, I think this was clear very early. Like this thing is just part of our existence now. These viruses, I'm not one of these, it's so interesting because I wanted to talk about viruses earlier. I've been wanting to send this tweet about like the origin of viruses going back to like February. Uh-huh. But I felt like if I sent it, I would be immediately canceled. Do you know what I mean? Like immediately. But actually, if you read about how viruses have evolved from actually probably independent organisms to dependent organisms and how they intersect with humans and over time, if you can have those conversations in a meaningful way, it's so interesting and it's so important to understand. It's instructive that almost a symbiotic relationship. Like viruses do not want to kill human beings.
No, they don't.
They don't want to kill anybody because they depend on us. If we die, they die. They just exist to propagate their genetic material. By the way, as do we.
Yeah.
Do you know what I mean? Like our only purpose is like to propagate genetic material. And so I think that like, I think at some point our expectation of the numbers of acceptable cases is gonna modify.
Yeah.
And I think, and exactly that shouldn't change. The example I often give is that post SARS in Canada, obviously SARS part 1 was a major thing in Canada. It didn't really come to the US for a number of reasons, but it was a major thing. And post SARS, there was an outbreak in British Columbia at a long-term care facility where the antibodies were cross-reacting with SARS antibodies. In fact, it was OC43, and it killed. It was deadly. But it wasn't SARS. And so I think what it says is like there can still be risk, even in the context of vaccination. We don't know how well this vaccine will work in really elderly folks. There's a lot of open questions that exist there. And so, these things could remain deadly, and we're going to have to really step up our support in terms of, infection prevention, control, et cetera, within these settings. But I've never been one, and I think this is like where I don't know if I get canceled anymore. I think I've said it enough, like that a restrictions-based approach to public health is an appropriate response to public health. And for me, I feel that like you can do restrictions after you've put in place all of the resources that people need in order to prevent transmission. We can get into the weeds about what that means. But I've not been one to sort of think that restrictions are an effective response. So to me, I believe, and I've stayed away from prediction online, and then I'm going to hand off to Julia because this is such a dangerous game. I do not think, in the context of the amount of immunity that we have now, as well as a vaccine, that there's going to be an additional wave in the winter of 2021. I believe that there's going to be a seasonal effect, that there will be a seasonal slowing towards the summertime. And I believe that at that point, it's going to be much more difficult. Right now, it's maybe more the extremists and the COVID deniers that are marching in the streets. Although I will note in France, the protests are not small.
No, they're huge. They're huge. Yeah.
They're huge. But nonetheless, that in North America, they've been more along. Most folks have just kind of gone along with it.
Yeah.
I do think once the ICUs and emerges are empty in the summertime.
Yeah.
And that there's going to be a lot more pushback, and more broad pushback if these are the sorts of approaches used moving forward. And I think you won't have the kind of strange political angle and things. So I do think that the summertime is a time when our lives start approximating more of what we used to appreciate. And hopefully it'll be a better normal. I've heard people say this, that one where we do pay more attention to benefits and structural racism and the things that create these extreme disparities, across societies. But I still believe it'll be more of an approximation of what existed before. That was a long answer. Thanks.
No, it's a great answer. Julia, what do you think?
Yeah, I refuse to make predictions, but I think one thing I would just raise is the end of the pandemic. it won't just be measured by a number of expected versus observed cases. It's also kind of a collective perception and individual perception. Every person probably has some sense of like, I'll know the pandemic is over when ... And it might be when my kids are back in school full time, or when I'm able to go back to my job, or, when I'm not struggling to find something to eat, whatever the case may be, when I can just see my friends, when I can go to a club, and as those things start to happen, I think there will sort of naturally be, I guess my point is there is an epidemiologic way to define the end of a pandemic, and then there's more of a psychological experience and perception way. And some of that is going to be driven by the amount of attention paid to it by the media, as you were suggesting.
No, I think that's so well put, because for most of us, I think pandemics end when you feel that sense of normalcy in your life. You're going to do just probably maybe not as you were doing before, but just something more than what you're doing now, and something enough to feel like a real person again. I just wanted to say one thing. I mean, I wanted to pick your brain on one thing. I guess one of the reasons why I've always been troubled by the way in which the Great Barrington Declaration signatories have been signed, the way in which I think John Ioannidis has been treated, is that I think even though there are some real areas of substantive disagreement, and those areas deserve to be fleshed out, and there may even be errors in some of the manuscripts and at some portions of the preprint process, I think there were serious errors, and those deserve to be discussed. I do think it is a mistake to view all those people as evil people, and that they are, I don't know. I mean, I really don't think they are evil people. I know they're not. And I know they're not motivated by any financial consideration, because there's no financial winners when the world is dying of a pandemic. Even the JetBlues and all these right-wing crazy people who they think you can just reopen the economy, they will not make a dollar if everyone is dropping dead. Okay, so there has to be some guardrail. Like, no scientist is there's no check big enough to get me to say some crazy thing that I don't believe. I believe they believe what they say. And so it troubles me that they have been really treated, I think, as pariahs, especially on Twitter, because for all the things that I think are worth talking about and talking with them about, there is something they're saying that people are not hearing that I think was really important, which is, can our society take these restrictions without resources? Can we take it? And in the original essay that this guy wrote in March, he said, if you keep restricting society in this blunt way, you do not know what will happen. You don't know if there'll be civil strife. You don't know if democracy itself can sustain it. And the reason I say this is because I'm worried. Before this pandemic, I'm like an Elizabeth Warren. Like, I think that the way in which money flows through our system is the deep rot of this society. It consolidates in the hands of few and is perpetuated in their offspring. And it is not freely distributed. And the American dream is dead. I mean, it was there in post-World War II, and it has been, severely impaired since the Reagan administration. Upward mobility is down. Many people cannot live as good a life as their father compared to their grandfather, or their mother compared to the grandmother. That breeds deep resentment. And all of the things we've done, we have not even yet seen the full ramifications of this, the economic impact. But it's not impacted, my stocks are way up. I don't know how the fuck that's possible, but my stocks are the highest they've ever been. But people who don't have enough money for their next meal, whose kids are going hungry, they are hurting like they've never hurt before. And I guess, I think it's abominable. I think it's unconscionable that that's happening. I also think that even if you're just a purely selfish actor and you don't really even care, you should care, because there's so much of this that's going on that the entire society is going to face a deep crisis. And I don't know if you all think about this, but I thought about this when I was reading Steph's article, because Steph's article was sort of a very broad umbrella review of other things that are suffering under COVID, like tuberculosis control, like malaria, like hunger. And I think it's so easy for people who spend their time wanting to get the message out about restrictions to not think about these domains. And it's so easy to say, we don't have to, people are literally saying, like, not only are the Great Barrington people wrong, and here's why, they're saying they're so wrong, we cannot even talk to them. They shouldn't be talked to. They should be quarantined indefinitely in a hotel, and they should never be allowed to speak or be heard again. We don't want to interact with them. They're so poisonous to us. And to me, that really scares me, because I think that, whatever disagreements you have with them, they are pointing out one thing that we're not really taking seriously, which is, what are we going to do about this impending, I think, greatest catastrophe we've ever seen of income and wealth and hope inequality. There's like, all right, that's rambling, but any thoughts, Steph?
No, Julia, I took the last one.
Julia, yeah.
I think Steph is going to have a lot to say on this, but maybe I'll just say, I saw the Great Barrington Declaration and the John Snow memo as both having really valuable perspectives that were neither of which were fully fleshed out and had polarized each other. So
yes.
One, the Great Barrington Declaration was focusing on the harms of our response and our restrictions. And those are very real. And then the John Snow memo, in reaction to that, and the Great Barrington Declaration had really been in a reaction to the lack of attention to those harms, I think. And that's fair, but didn't really flesh out like some other aspects that are really important. Like how does focused protection work, for example?
Right. That's what I was saying. What does that mean?
A minor detail.
Minor detail, but like, what does that mean? Well, I'm going to get Martin on. I'm going to talk to him about it. But yeah, I'm curious. Yeah.
But then the John Snow memo, I think, was focusing on the harms of the virus and what happens when you leave this unchecked. And of course, that's a very real question too. And those early papers you're referring to from March, the early op-ed from John Ioannidis that was saying, well, we don't know what's going to happen. Well, sure. But like, we also imagine a world in which we did absolutely nothing to respond to COVID. And that's a horrific counterfactual.
Yes, I think it is.
And so there's no simple truth here, but the unfortunate part, I think, is the polarization that makes it very difficult to have productive conversations that are in the gray area.
No, I think that you're hitting on it. I thought that I said at the beginning, like, I thought that the Great Barrington, I wanted to know more. What does focused protection mean? But Jon Snow, I wanted to know more about like they're like, maybe we should use lockdowns until the vaccine can come and all these things. But I wanted to know more like, well, what's your plan for poor people who are hungry? I wanted it to say, like, I mean, this is what I wanted it to say. I wanted it to say, like, look, we fucked this up. We fucked this up because we should have had a pandemic response team. So the moment we heard about cases in Wuhan, we flew a whole team there and we did all this work. That's what public health really means. And we need to go after contact tracing at the source. And we shouldn't have let China stonewall us and these sorts of things. I wanted to say that we should have maybe shut down travel earlier. And when you shut down travel, you shouldn't announce you're going to shut down travel. So you get everyone congregating in the airport and spreading. Okay, that's not a good plan. I wanted to say that as long as we're going to have restrictions, every time we put a restriction, we're going to send everyone a check for $1,000. Every restriction, another $1,000. And if we cannot get you the $1,000, if the political parties will not allow the $1,000, we will have to rethink the restrictions because we don't know. If we cannot get people $1,000, we can't just restrict to protect some people and not others. So I wanted to say specifically, and then the last thing I'd say is this is something that Matt Smith told me, the philosopher, Matthew Smith, which was that many of the experts are happy to go on TV and say, you people out there, wear your mask, wash your hands, don't meet your grandma, you listen to me. And he says, why don't they go on TV and say, listen, you people in the Senate, if you do not pass checks for $2,000 for everybody, I'm coming for you. I'm going to bring every ounce of my academic credibility to fuck you up because you are killing people, because you are not supporting people. You can't just put restrictions up. You got to get them money. And I don't give a shit about your ideology. This is not the time for those games. But they don't use their pulpit for that because that puts yourself in vulnerable position. Like then they'll say, maybe you shouldn't be dean of this public health school. Maybe you shouldn't be the fundraiser for the Harvard program or blah, blah, blah. That puts yourself out there. So, I mean, I thought he made a really good point and I didn't really fully process it until I listened to him over again. And anyway, Steph, I know you have a lot to say on this issue.
Yeah, I mean, it was a lot, right? I mean, I think indeed it was when we think back to sort of China's response, and I say this as gingerly as I can, there was a lot of hearkening back to SARS in terms of what happened, which is, decentralized governments within China. I think there not being great communication with teams in Beijing. There being, wanting to be really a lot of control over the messaging that came out maybe as much focus on like the message that came out as the response. And I think we've seen a reporter now, be sentenced to jail.
Yes.
We've seen early folks die and not be rewarded. And I'll say, this isn't the first time. In fact, it reminds me of SARS. It reminds me of the paid plasma scandal. Like there's a lot of things that we need to understand that would have been early prevention, and meaningful approaches that it do include travel and restrictions and things. So I think it's not to say that blanket travel restrictions. I will note, I like to think I was on a COVID tour the early part of this year. I think maybe both of you I used to travel up until until 2020, about 200 days a year.
Oh, wow.
So I traveled about 400,000 miles a year, and I was on the road about 200 days a year. And I was in, even in the first 3 months of this year, first 3 months of last year, I was in Asia, I was in South Africa, I was in West Africa, I was in Japan. So I was kind of like, COVID was following me, or I was following COVID. I remember I landed in Geneva.
I'll do the contact
Bangkok.
tracing about this, Sven. I'm going to get to the bottom of what happened here.
I was bringing, I don't know if I was, but I remember I was on like a Bangkok to Geneva flight, and I landed, and then they were like, oh, there's a case in Switzerland. Like it was literally wherever I went, there was COVID everywhere. And so it's, I think we could talk a lot about
you're not typhoid Mary.
Yeah,
in this
but
okay.
I think what was interesting was that when I landed in JFK,
yes,
having just been in Asia, they they were like, and I use global entry, and they were like, do you have you been to Asia? I go, yes, I've just come from Asia. Where? Japan. Okay, no problem. And it was really my global entry didn't work. Like you had to go through, and they just were like, basically, have you been to China? I don't know actually what would happen if I said yes to China, but he's like, all right, peace out. And then you go, and so it's like there are things that like absolutely like airport screenings and things, and that could have been set up very early. And it's not to say that I was against those. I don't believe necessarily you can control internationally, but I think you can be responsive to like airport screenings, et cetera, and be thoughtful. But I think, so then, talking a little bit about polarization, I will say it's so interesting that like we wrote a piece also calling like balancing the response, balancing precaution and unintended consequences. And we started writing that March 13th or 14th, and we published it in April. And it was just like a little paper. It didn't get a lot of attention, but it was just something that like things we wanted to say with a bunch of different folks. But then I saw this response to John Ioannidis, who, by the way, like for those of us who are epidemiologists, he's like the most cited person.
I know.
He's like the Barack Obama of our field. You know what I mean?
Yes,
like, he's, I don't know. I think I looked it up. He has like something like 400,000 citations or something. So it's just like this incredible amount. He's in the 1,000 paper club. Do you know what I mean?
Yes.
And so there's sort of like, and so to see him go down as this like right-wing conspiracy theorist over what seems to have been like a $5,000 thing that like, he obviously didn't, it's like, you're going to give up like your lifetime of a career for $5,000. Do you know what I mean? Unless there's like millions of dollars
paid to the university, not to him directly.
Paid to the university.
Right. Yeah.
And so, I mean, I think it just was like, I think that, when you talk about financial impropriety without like getting into the weeds of it, it feels wrong. And I will say that like, I agree, like the Great Barrington Declaration, that the reason that I didn't sign it, and I said this to Martin, who I respect and I like.
Yeah.
And we wrote a paper together. Was that it just like, it didn't include the things I wanted and that I've been doing a lot of local advocacy for. And I think if they just written it to focus on principles, like just these are some core public health principles that we think are important, rather than like getting into the weeds on like an implementation plan, and then maybe followed it up immediately with an implementation plan, maybe it would have had a different dynamic.
Yes,
I also think there was mistakes of like engaging like politically. There was a lot of things that I think were complex that I think were mistakes. And by the way, like I don't think you needed to do any sort of event around it. We could have done it virtually.
I think that
it could have
was
been
a mistake.
Like the champagne and the wood,
like
all of it.
That was a mistake. Bad branding.
Such a mistake.
Bad branding.
Yeah, all of it. That's right. And I think that, so like those things were, but it's, I mean, like the idea that he himself is like an evil person, I thought was a mistake. And I think the only advantage I have is like, I just don't care what people think about me. I have a family. Do you know what I mean? I say this to Julie all the time. Like, I have a family. I really care what my family thinks about me. Even a lot of my family doesn't necessarily always like me all the time, but like, do you know what I mean? Like, but like them I care about. I care about a few professional folks because they've been my mentors and others. And I've never been popular and I just don't care. And I think, but at the same time, like, you know, it's amazing. Like I actually felt professional fear for the first time. And I remember talking to my partner at home and being like, I might just end up being a family doc at the end of this. And which is fine. I love what I do. And you know what I mean? But like my career may end as a result of like me being, and by the way, you know, Jiwon is also in a bit of a high profile position. And I was like, this could reflect poorly on you. And I think, you know, we've been supportive of each other in this household, but it was like, that was the sort of conversations we're having in April. And I feel more okay with it now. But, you know, there's been like, I was like New York Times stories about like, you know, like it was like, you know, related to Great Barrington and all these things that were like, I think really made me professionally afraid. And that's a mistake because as we talk, you know, with colleagues of ours who are more junior, who are so smart.
Yes.
Doctorals, like there's been some doctoral students who have had no filter.
Yes.
And postdocs and whatnot.
Perhaps
and there's been some of
detriment.
the smartest doctoral students. Yeah, that's right. I mean, but some of the doctoral students that are like the smartest people I know who are so afraid of saying anything.
Steph,
and
dude,
so you
everybody I know, my own generation, I'm 38. People my cohort, they're like, what are you doing? They're like, I'm getting phone calls off the hook and they're like, shut the fuck up. They're like, COVID off your radar. Don't talk about COVID. They're like, just do your cancer. Shut up. Shut the fuck up. And I'm like, I don't know. Anyway, we can talk, but I mean, I'm getting a lot of, I mean, I've
shared with Julia actually going back several months, without specifics, also like warnings from folks. Shut up.
Infectious.
And I'll just say, like, you know, it's actually like the experience, like throughout all of this, while I've been on Twitter, I mean, not to self-aggrandize, but like, I'm still working in homeless shelters. I'm still doing outbreak management. And like seeing that is like reminding me what a shit show this is. And it actually, that part is enraging because throughout all of this, they've not been part of the story and the part of the conversation when they've been so disproportionately affected. So it was like, I think it was like also just like hands on the support, you know, seeing it and the disconnect between the narrative and the media and like what was happening. I feel like that's changing a little bit now. So I feel more optimistic, but nonetheless, I think that like that part was really tough for me. And part of the reason why I'm like, no, you know what? I'm like, I'm going to keep rolling my dice here and I'm going to keep going down. And by the way, also like Julia Marcus, you know, and it's like support from somebody as thoughtful, you know, as Julia and a few others is like, that is like strong. That means the world. Do you know what I mean? In terms of like saying, you know what, I'm going to continue down this path for, you know, and see where it goes.
I wonder if you just touch real quick on the one part, after all this is over and people look in and the income inequality and the wealth is bad. I mean, I wonder if you might just talk for a minute.
You know, I think that like, I always, the way that I've always thought about inequalities is that they can happen quickly and take a really long time to fix.
Yeah, exactly.
And I think we've seen these like shifts, whether it be famines, you know, other public health emergencies that have arisen, you know, that the inequalities that happen obviously are going to affect people on the margins and they can happen very quickly. And I'll just say the paper, by the way, you know, Julia is a main co-author of that paper, which I'm very thankful for. And, you know, is that actually like it was one of our doctoral students who's from Rwanda, but has been at Hopkins for several years, noted just his fear of just the intense amount of starvation that's happening, even in the context of a relatively wealthy, Central Eastern African country. Like, you know, and so, you know, each of the sections was written by somebody who's really passionate. Anna Kogesson, from Sweden, focused on reproductive health. That's her area of specialty. Mugi Sevik on TV. Carrie Lyons works also on a number of things, but malaria.
I see.
And then Amrita Rao on HIV. So each of the folks kind of got to like write, you know, these areas that they're passionate about, not coming down just on the response. It's not about disentangling, I think, as Julia said, the pandemic or the response. It's just a thing. And just at least being aware of it. And also, like, people keep saying it's once in a lifetime. I'm like, it's just not.
Yeah.
This is not once in a lifetime. This is going to happen again.
Yes.
We are going to have another, whether it be, I worry, by the way, about influenza next year. I'm just going to like put this out there.
Of course. 1 year without any.
Yes. Without any. I have such grave concerns about what's going to happen with influenza next year that I don't, it actually, it's one of these pandemic, like I wake up at night and just be like, oh my God.
Yeah.
But I'll just say, so anyway, so it's not once in a lifetime. We have to kind of like create surge capacities in our systems and shock capacities and think about messaging and the social media. I'll stop there, but I just, it's going to take a long time to address. And the last thing I'll just say about wealth, is that like, your stocks are going up. That article that I shared in the New York Times, I've never been so angry about reading something about why the economic fundamentals during this time are strong.
Yeah.
It's enraging. It's the fact that overall, like the economy's gained $1 trillion because of this shift.
Yes.
It turns out like small business is not good for the economy.
No.
Like that is enraging. And so indeed, like people's stocks, I will note, and not that I don't begrudge anybody for owning them. I guess I have a retirement plan.
Yes,
I don't like own stocks, but I've seen them go up. I understand that they're going up, and it's like never before have I understood such a disconnect between Main Street and Wall Street, with also the amazing thing of the fundamentals of Main Street being strong in the context of such grave suffering. Like it's enraging.
I think,
but it also speaks to why folks are comfortable. Sorry.
No, it enrages me so much, and I think it speaks to the fact that these people with lots of capital assets are in a position where they are confident that the United States will never let them fail. They will never let them go bankrupt because we can't let rich people go bankrupt. We can let poor people go bankrupt, and I think that's what enrages me the most. And when I saw my retirement account and I saw it plummet in March, and I said, okay, fine. I got hopefully a long time before well, who knows? If I do more podcasts, maybe it'll be quicker. But I thought hopefully it'll be a long time before I retire. Then it's coming up like through the roof. It's ridiculous. Okay, but I wanted to talk before we have to go, and I'll have Julia talk about this first. Schools. I think that you were and I might be somebody who's on the bad side of this too. But there are strident voices on schools, and I've fallen into where I want to sit on schools because I've read enough, and I think I've reached my view, which is that my view isn't that they have to always be open. My view is that that unless the healthcare system is actually at capacity, then it's got to be open. And I came to that view because I looked at the different domains, how it affects parents, particularly women more than men, how it affects children, particularly poor children, minority children more than rich children, and just the real fact that that the school closure is just, it makes no sense. I mean, if you actually look at like which ones are closed and which ones are open, it has nothing to do with any property of the virus. It's just to do with who's got the money. All right. So there are a few, so I think I take a hardline position on the open side. But I think there are harder lines. I mean, I think there are people who are really even more than me. I see a lot more hardline positions on the keep it closed side. We don't know for sure. It could increase deaths, those kinds of things. I wonder how you think through it. You're somebody who's, always polite, doesn't want to get too stuck in the controversy, but you also want to speak up about, I think, everyone's, rights to think about this. How do you view the school closure debate? Do you think some of the messaging does us a disservice? Maybe I should actually become more moderate, but I mean, how do you think about it?
Yeah, I would say I've taken very few hardline positions during this pandemic, and there's probably a few reasons for that. One is just uncertainty. Like I really am sure of very few things.
Yes.
I have taken a hard position on shaming and certain, ways, blaming the public, those kinds of, elements of public health communication that to me are like non-negotiably bad.
Yes.
But schools is one of many things where I feel like, yes, it's clear schools should be prioritized above many things in society. I also think it's a Rorschach test, that people see what they want to see in the data to some extent, that people look at the same sets of studies and draw different conclusions, and they are 100% sure about those conclusions. And to me, I don't have that certainty. On the other hand, I have a conflict of interest here in the sense that I'm a parent of a first grader who is really struggling with remote learning, has not done, he's fine, but he hasn't done great during the pandemic. And we're probably in the top 5% privileged people in the country, right? So if he's having a hard time, I imagine there are many other people who are having a much harder time. And so faced with that reality every day, I almost feel like I can't say anything really strongly about schools. But what I do say is that I feel like calls to just close the schools, as we've been talking about, resources before restrictions.
Yeah.
You have to think about what that means for
Yeah.
people, what that means for kids, what that means for working parents. Parents who are working at home, it's hard enough. Parents who can't work at home, what does that look like? And how are kids' needs and parents' needs not being met in that situation? And how can you meet those needs? So I think it can't just be a call to close the schools. It must come with that broader context. And I would say that for everything during this pandemic, that anything you're calling to close, you have to be thinking about that context. And even anything that you're asking somebody to do.
Yes.
Quarantine, isolate, distance, wear a mask.
Right.
Like, think about the context there. Give them a mask if you want them to wear a mask.
Right.
Think about like what actually needs to happen to help this part of society be altered in this way.
And that's what, my friend was telling me about Taiwan, and he's like, when you go there for quarantine, they give you the hotel to stay at, they deliver you the food, they check in on you, they give the app on the phone, they make it easier for you because that's what you need to do. And in this country, you need to do even more because people have less to start with. I think we've had and the schools thing. The one thing I have to, it's my soapbox, but if you Europe is not closing, they're doing everything they can to not close the schools, and actually the schools are more important here because we have a worse situation with income inequality, with racial inequality. It's worse here than it is there. We're the ones who should err on the side. We should be a little bit more aggressive in opening the schools than they are, at least. I think. And so I get troubled by that. And I don't know. I do there's some Harvard student who messaged me privately, and he's working on this, trying to estimate something. But there's certainly some number of cases of child abuse that are not getting reported, and maybe there is some trade-off that if you open schools, there's going to be a few more people who die. And then he says, though, I mean, his gut feeling is that if you were to articulate that trade-off, how many more people may perish so that there are X fewer cases of child abuse? He says, people will be willing to sign up to perish to avoid the child. I mean, he's not trying to be grim about it, but I know I would, if you're telling me that my sacrifice would mean that some kids are no longer in abusive situations, sign me up for that sacrifice. But he's saying that if you made that emotionally valent to people, you just show them the trade-off, that people will feel so different in their soul about this choice that we're making that we don't feel because we don't think at all about those kids and what's happening to these 3 million kids that are just frankly lost since March. Steph, and I know you have to go soon.
I mean, I think. Yeah. Oh no, I mean, it's interesting. I've just had a power outage. So, wow. I mean, I think my thoughts on schools are, I think you guys have already articulated issues to the students. One personal reflection that I thought was interesting was in talking to friends in Sweden was, I mean, if you cannot work remotely, right, then, you what is the age of kid that you can leave home alone? What is that age? Is it 12? Is it 14? Is it 15? So, without relying on help. And it's probably, in Sweden, the decision was close schools for those 16 and above, including universities, and leave them open for those who are younger. And I'll note a number of healthcare workers, clinicians who are going to be addressing the needs of COVID were thankful because there's not really a great backup, and I think in a lot of scenarios, by the way, including in my own circles among clinicians, where people are relying and bubbling in some ways with their own parents,
of course,
to help them with childcare issues. Yes. And you've created this sort of, this dynamic that I think is suboptimal. And that's only when you have the luxury of having folks that are able to do that. And so I think, I don't know that, I think this question about one sacrifice for another, one of the challenges that I've seen in that is often a mismatch of sacrifices. Mm-hmm. It's always the sacrifices always end up stacked up on folks who were already, disenfranchised and kind of economically marginalized to begin with. So it's tough because I think, the sacrifices just end up completely on one side. So we say we're all ready to sacrifice, but in fact, most of those sacrifices are being borne by people who are already most affected by COVID and, pre-existing kind of inequities. So I think the school issue that struck me was just this element around if, there's something I'm going to avoid mansplaining, but the statistic was something like 2 million women who are not in work that were working. And I think people have had to leave the workspace to manage. And, and as with everything in society, women are stronger and bear more of the sort of responsibility. So I think those things I think just shouldn't be dismissed. It just at least should be part of the conversation. That doesn't mean that we're not denying anything. It just means that it should be part of the conversation and not in a way of like, if I say this, that means that I'm like a bad person for even raising some competing health issues or competing thoughts. No, and the reality is it's only then, well, why don't you think about ways to, overcome those challenges in terms of like making sure people are not fired, maybe organizing like childcare or other things so that, as Julia said, and as you've said, like you match a resource with a restriction. I actually am like, I'll say this, like first of all, I don't think you could lock down the world, but like, even if you could, it's fine. Do it. But make sure that actually then like every farmer who gets paid by like lettuce plant that they pick up, everybody in a supply chain who gets paid daily, who's in the gig economy, these folks, we have to create systems. It's not easy. We have to ensure that these folks are going to get paid. Somebody has to pay them. Undocumented folks, documented folks, contract hires, agency hires, all of these folks. It's like the systems need to be put in place. And then sure, like lock it down, shut it down, do whatever you want to do. But it's actually just it never plays that way. It is always the fact that like we say these things and then we shut down and we're like, we'll figure out school lunch programs or we'll figure out how to ensure people don't get evicted. We'll put a moratorium, which by the way, people need to come up with somehow like a year's worth of rent in like a few months or they're all going to get evicted. So there's a lot of these like accumulating issues that have not been meaningfully addressed and have not been part of the narrative. And they should be, because it is is indeed like one of the most complex times in history from that perspective.
I think that's well said. I guess the last thing I want to ask you guys before everyone has to jump off is a question about I guess, all political parties, I always hear people say that, they want to, there's always some element in a political party that has a very fringe or, a hurtful view. And, I often hear people talk about like, we got to get that part of the party under control. Like if we don't get them under control, like it'll hurt us all because we're all going to look like we hold these fringe views. And I guess my worry is that, there's some truth about that with public health experts, epidemiology, the academia around those like people who are prominent now. There are many people who are balancing things, well-intentioned, and then there are a few people who are in our party. I mean, they are public health people, but they are maybe taking a fringe view. And I guess, somebody listened to my show and they're like, this person wrote me this long, very sweet email, but it said like, you're much more critical of people who are very close to you than you're critical of people who are far from you. And he said, why is that? You're never critical of the people who, you're on the other side of the issue with. And then I'm like, well, I'll tell you why, because like, I'm trying to like help my people. Like I want us to like, I think that if we can get our messaging a little bit better and we can move a little bit on some of these issues, like we would be in a more stronger position to get our point of view across politically, economically, and in medicine. And so that's why I'm more critical of people closer to me. Not that I don't love them. Of course I love them. That's because they're closer to me, of course. I guess I'm wondering, like, I feel like you both are in this business, that part of what motivates you and you're cognizant of is you believe in public health and you believe in your professions, and you're trying to bring everyone a little bit towards your point of view, a little bit of moderation, a little bit of thinking about these things, not because you don't like them, but because you want to be stronger and you worry that the positions they're staking out will leave us incredibly vulnerable in the future. I wonder if you might, close with some thoughts on this, if it means anything to you. Julia?
Yeah, that really resonated for me, actually. Just, I've written this series of essays for The Atlantic during the pandemic, which I hadn't expected to do. And while the audience is the public, my secret audience in my head, who I'm writing for, is my colleagues. Yeah. And so I could write for a peer-reviewed journal, but I don't think it would work quite the same way. And yeah, I mean, there is a way that yes, I want to put pressure on politicians who are in positions of power who can make policies happen that will make things better. And I've tried to do that to some extent in the way that Matthew Smith is pushing us to do.
Right.
I ultimately, my own personal crusade is wanting to make public health better and make public health stronger. And I see ways that I worry during the pandemic about what is happening with public health communication and policies, and also all the things that are happening that are not public health's fault. So, you know, I'm on this crusade about like trying to shift the way that health professionals communicate with the public. But also there's a lot of things happening right now that are out of public health's hands. Politicians making decisions, you know, just, and all of that is going to fall on public health.
Yes.
Everyone, I think all of that is perceived right now as big public health. Literally, this is like a phrase people are using, which makes me laugh.
Health.
Like, what is big public health? I wish we were big.
Yeah, I know. With the budget of $100,000. Yeah,
exactly.
Right.
But we are going to take the fall for all of that.
Yeah,
and it's just something I've been sort of conscious of and worried about. And so to the extent that what's within our control, the ways that we communicate with the public, the policies we do have some influence over, like at least that we can take our little corner of that and do our best. And that's what I'm trying to do.
I think you're doing a great job. Steph, I'll give you the last thoughts, then we'll go.
Yeah, I mean, so thanks for that. And I really do echo and feel very aligned with what Julia said. I think, you know, my perspective is at the end of this, people are going to lose interest in public health. You know, I mean, when whatever it be in a year or 2 years, but like those of us who are committed to this space and this field are going to be in this space for our lifetimes if all goes well. And, you know, and we're going to be, I feel like we're going to be picking up pieces. Folks, virologists will go back to virology work. Immunologists will go back to immunology. Clinicians will focus more on clinical work. And those of us like in this space who are trying to like develop policy and programs that are meaningful and address people's needs are still going to be in this space. And so, you know, what I would like at the end of this is that public health, like, you know, kind of sticks to its core principles of like, you know, equity, social justice, and participation. I always say that these are three things that I consider to be fundamental. Equity in the sense that we do more for people who need more. Social justice in the sense that we, you know, balance intervention benefits and burden. And participation in the sense that we ask people about the interventions that we want to deliver to them and ask them about how to best deliver those. And so, you know, I think we need to do those. And broadly what that means is a return to empiricism. And so I want at the end of this that public health still maintains this view on empiricism rather than the sort of hammer. We're just going to like, you know, hammer and dance and all these folks that are like going to move on to whatever, like computer programmers and app developers will go back to their spaces. Yeah. And we still need to develop, you know, meaningful programs in the space. So that's what I consider fundamental. And that's why I'm here and I can, you know, and will continue to for that matter.
Well, thank you both for doing this. It's been a lot of pleasure. I'll just say I look forward to the day when I can go from being told online that I'm not qualified to have an opinion on these matters to return to my old way of being where I was told I was not qualified to have an opinion on cancer drugs, which is what I do in my day job. My day job, that's what it was like before. I was told I wasn't qualified to have an opinion there either. So, but thank you both for doing this. This is really a lovely conversation. And, you know, I really appreciate this discussion. And I think, you know, if everyone heeded, you know, all your advice and read all your articles, we'd be in a much stronger place. So, Julia Marcus, pleasure to talk to you. Steph Baral, pleasure to talk with you both.
Thank you so much.
Thanks very much.
You've been listening to Season 3 of Plenary Session. Plenary Session is produced by Kiana Klossner. Music by Ian Straley and Audrey Tran. The views expressed on Plenary Session are those of whoever said it and no one else. Plenary Session is not medical advice. Follow us on Twitter at plenary_session. Until next time.